I'm Dr. Jeff Waldron. Today I'm going to talk about one of my favorite things to treat, and a lot of people don't realize physical therapists can treat this, and it is jaw pain or TMJ. This occurs in about 35% of the population, but very few people actually seek out treatment and care for this condition. So in this video, I'm going to talk about what it is and some few exercises that are helpful for it. There's a lot of different causes for it, so not all these exercises may help each individual person, so it's important that you seek out a skilled physical therapist, maybe a dentist and some other people on your team that can help you with assessing this and treating it. So I hope you enjoy this video. What is TMJ? As I talked about earlier, it affects a lot of people, over a third of the population. You can see here on the skull, we have a jaw here, and the TMJ is this joint right up behind the jaw and close to the ear. It's this big bone here called the mandible, and you get both joints interact together. So what's happening on one side can be affecting the other side. So if this slides one way here, it affects sliding to this direction because there's an issue here, or it can affect the other side. So it's very interrelated between the two joints, and we often treat both of those. Likewise, the spine is right here, so your first cervical vertebrae is right behind the ear, and so the upper neck affects that. So 50% of jaw pain is actually something going on with the upper neck because of the close proximity into this area. And it can show up as just pain in the jaw, it could be clicking in the jaw, it could be difficulty opening, it could be these aberrant movements or changes, and it also can be causing headaches. TMJ is actually one of the 7 types of ways you can get headaches and creating pain, where it's compressing up in here and giving you this type of headache pattern above the ear and can give you some difficulty. So it's important that you're appropriately diagnosed and evaluated by a physical therapist that does TMJ treatment. And they do an exam of the tension and muscle relationship between the neck and the jaw muscles, and several of these muscles move from the jaw into the neck with attachments at both points. You also want to get evaluated by your dentist. Maybe you've had some x-rays and look to make sure your bite is appropriate and you don't need a night guard or some other things as part of this process. Okay, first exercise. Oftentimes people have a lot of tension here in the neck, and they've had poor posture where they're resting their head forward like this. So you need to stretch out these muscles at the back of the neck and work on the chin getting in. So just a simple thing here is just to do some gentle chin tucks, getting the jaw to rest back, shoulders back, and consistently several times a day do some of these chin tucks to strengthen the front of the neck and get these joints moving like this. So just back and forth, nice and easy, tucking the chin. You don't want to go down. You don't want to go really far back. It's just a gentle head nod, like you're turning a dial right at your ears, going in and out. So those chin tucks, you can do them several times a day, 5-6 times a day. You don't want to overdo it and pop up the muscles in your neck. You want to just do it nice and gentle. Tongue to the roof of your mouth and the palate behind your front top teeth. Up here, doing the chin tuck like so. Second thing I'm going to show you for exercises is often people get so much tension because they've had the poor posture. They're clenching their teeth because they're a little bit stressed out. So oftentimes I'll have people do some gentle massage where they'll massage the back of their neck, just doing gentle circles. They'll start to massage the jaw. The massage up above the ears because there's a muscle up here that helps with clenching down. And then you do a gentle mouth opening. Just where you can, gently, just to get a little stretch. Nothing too aggressive. If you have locking or some of those issues, you don't want to extend with opening the jaw too wide. But again, gentle massage, circular motions, massage the back of the neck. Just right here in the back, above the ears, and then mouth opening. And you can repeat that several rounds in order to help relax some of that tension in the face and neck and get those muscles moving and the jaw moving a little better. Okay, next exercise, we're going to do some isometrics, which means you're just going to press and hold. So a couple of good things we can do. Sometimes the jaw is moving one direction, so it deviates over one way or another. If you're getting a little bit of a click, so you want to stop short of that click, and then so you can open part way to where you need to work on that area, and then you can just kind of press gently into your fingers, holding for 3 to 10 seconds, pressing the other way, holding 3 to 10 seconds. You can go ahead and feel what your joint's doing, and you can press down gently. So you're making this little touchdown. Tongue to the roof of the palate here. And then you can also do this direction too. So you can do all 4 directions, working on just turning on those muscles and trying to get symmetry left to right, up and down with doing your isometrics. Okay, last one's kind of a funny one. It's for stretching the jaw. You kind of pry back and forth with your fingers, so your thumbs go to the roof of the teeth and the index fingers go to the bottom, and then you do a little this motion. So you're here like this, and your fingers are just doing that. So index fingers on the bottom, thumbs on the top. Just getting a little bit of a gentle stretch with your teeth, stretching some of those muscles out. Again, proceed with caution. Not all of these are for everyone, and that you need to be appropriately diagnosed for which problem you have with your TMJ and what's causing it. But these are some general strengthening and range of motion things you can do to help with reducing your jaw pain, your headaches, getting some tension relief through there. So I hope you find these videos helpful and you enjoy them. And if you do, please share it with your friends and family. And again, seek out a consult with a skilled physical therapist that knows how to treat TMJ. Thank you for watching.